Before we go through into our topic, let us meet and greet our group members. The first one is Hali Sumayah binti Muhammad Hamizan. The second one is Mimi Nur Ain binti Azhari. Myself, Nur Aina Sofia binti Muhammad Asri. And the last one is Hana binti Alauddin.
Introduction of ultrasound. Ultrasound, also known as sonography, which is a powerful medical imaging technology that uses high-frequency sound wave to visualize internal structure within the body. Unlike X-ray or CT scans, which use ionization radiation, ultrasound relies on safe and non-ionizing sound wave. So, how does it work? Ultrasound waves are produced by a transducer which can both emit ultrasound wave as well as detect the ultrasound echoes reflected back. In most cases, the active element in ultrasound transducer are made of special ceramic crystal materials called piezoelectric. These materials are able to produce sound wave when an electric field is applied to them, but can also work in reverse, producing an electric field when a sound wave hits them. When used in an ultrasound scanner, the transducer sends out a beam of sound wave into the body. The sound wave are reflected back to the transducer by boundaries between tissues in the path of the beam. For example, the boundary between fluid and soft tissue or tissue and bone. When these echoes hit the transducer, they generate electrical signal that are sent to the ultrasound scanner using the speed of sound and the time of each echo's return. The scanner calculates the distance from the transducer to the tissue boundary. This distance are then used to generate two-dimensional image of tissue and organ.
The relevance of ultrasound to scientific instrumentation lies in its use as a non-invasive imaging tool for studying biological tissues and processes. Here's a breakdown of its relevance in scientific instrumentation. The first one, imaging capabilities. Ultrasound provides real-time images of internal structures without the need for ionizing radiation. This makes it valuable for studying live biological samples, including cells, tissues, and organs, both in vitro and in vivo. Scientists use ultrasound to visualize anatomical features, monitor physiological processes, and investigate the effects of various interventions. The second one is versatility and accessibility. Ultrasound machines are versatile and widely accessible instruments used in research laboratories, clinics, and hospitals. Researchers can easily conduct ultrasound studies to explore a wide range of scientific questions across disciplines such as biology, medicine, veterinary science, and materials science. The portability of modern ultrasound system allows for field research and point-of-care testing in remote or resource-limited settings. The third one is quantitative analysis. Beyond visualizing structures, ultrasound facilitates quantitative analysis of tissue characteristics and dynamics. Techniques such as ultrasound elastography measure tissue stiffness, aiding in the diagnosis and monitoring of disease such as liver fibrosis and cancer. Doppler ultrasound quantifies blood flow velocity and direction, providing insights into vascular function and pathology. These quantitative measurements contribute to scientific investigations of tissue biomechanics, hemodynamics, and pathophysiology. Followed up is integration with other modalities. Ultrasound is often integrated with other imaging modalities and scientific techniques to enhance research capabilities. For example, combining ultrasound with contrast agents enables molecular imaging of specific cellular markers and biomolecules, multimodal imaging approaches such as ultrasound photoacoustic imaging and ultrasound magnetic resonance imaging (MRI) fusion offer complementary information and improve diagnostic accuracy in preclinical and clinical research studies. Lastly, the innovations in instrumentation. Advances in ultrasound instrumentation continue to drive progress in scientific research. Researchers develop novel transducer designs, signal processing algorithms, and imaging modes to improve resolution, sensitivity, and specificity. High-frequency ultrasound probes enable imaging of small anatomical structures with greater detail, while 3D or 4D ultrasound techniques provide volumetric visualization and dynamic imaging capabilities. These innovations expand the scope of scientific inquiries and enable new discoveries in fields such as developmental biology, regenerative medicine, and tissue engineering. Ultrasound relevance lies in its ability to visualize biological structures and processes in real time, contributing to a deeper understanding of living systems and advancing scientific knowledge. The relevance of ultrasound in application concepts is extensive, spanning various fields such as medicine, industry, and research. Here's an explanation of its relevance in different applications. First one, medical imaging. For this application, it has 5 sectors. First, obstetrics and gynecology. Ultrasound is commonly used for monitoring fetal development during pregnancy, detecting abnormalities, and assessing maternal health. Second, cardiology. It aids in diagnosing heart conditions, evaluating heart function, and guiding interventional procedures like echocardiography. Third, abdominal imaging. Ultrasound helps in visualizing abdominal organs such as the liver, kidneys, pancreas, and gallbladder, aiding in the diagnosis of disease like liver cirrhosis, kidney stones, and pancreatic tumors. Fourth, musculoskeletal imaging. Ultrasound assists in diagnosing soft tissue injuries, joint disorders, and guiding injections for pain management. Fifth, vascular imaging. Doppler ultrasound is used to assess blood flow, detect vascular abnormalities, and diagnose conditions such as deep vein thrombosis and peripheral artery disease. Another application is therapeutic applications. This application has 2 sectors. First one is therapeutic ultrasound. High-intensity focused ultrasound (HIFU) is used for non-invasive tissue ablation in the treatment of tumors, uterine fibroids, and neurological disorders. Second, ultrasound imaging guided therapies. Ultrasound is combined with other therapeutic modalities such as focused ultrasound, drug delivery, and gene therapy for targeted treatments and personalized medicine. Last application is in veterinary medicine. Ultrasound is valuable for diagnosing and monitoring conditions in animals, including pregnancy detection, abdominal disorders, and musculoskeletal injuries. It aids veterinarians in providing comprehensive care to various species. Ultrasound's diverse applications make it an indispensable tool in various fields, contributing to advancements in healthcare industry and scientific research.
Next, let us look into the detailed exploration for this topic. So, what is medical ultrasound? Medical ultrasound falls into 2 distinct categories, which is diagnostic and therapeutic ultrasound. The first one is diagnostic ultrasound. Diagnostic ultrasound is a non-invasive diagnostic technique that used to image inside the body. We usually use the transducer to produce sound waves that have frequency above the threshold of human hearing, which is above 20 kHz. But most transducers in current use operate at much higher frequency. This ultrasound can be further subdivided into anatomical and functional ultrasound. So the first one is anatomical ultrasound. This technique will produce image of the internal organ or other structures. Meanwhile, functional ultrasound will combine information such as the movement and velocity of the tissue or blood, the softness and hardness of the tissue, and other physical characteristics with anatomical image to create the information map. However, to optimize the image quality, the transducer may be placed inside the body via the vagina or blood vessel. In addition, ultrasound is sometimes used during the surgery by placing the transducer into the area that being operated on. The second one is therapeutic ultrasound. This ultrasound also uses sound wave above the range of human hearing, but this technique does not produce an image. It purposes to interact with the tissue inside the body such that they are either modified or destroyed. This technique uses a very high intensity beams that can destroy an abnormal tissue such as the tumor. One example of this technique is high intensity focused ultrasound or HIFU. HIFU is being investigated as a method for modifying or destroying abnormal tissue inside the body without having to open or tear the skin that might cause damage to the surrounding of the tissue. So this is some example for the ultrasound used in our daily life. So the first one is baby ultrasound. So how does this work? The sound wave will bounce off the baby like an anchor and will return back to the transducer. So the transducer will convert the sound wave into an electric image on a computer screen. Second one is the use in medical. The ultrasound probe is placed over the carotid artery. So a color of ultrasound image will show the blood flow in the carotid artery. Meanwhile, the waveform image on the bottom right will show the sound of flowing blood in the carotid artery. Ultrasound also used in veterinary works. Veterinary ultrasound are non-invasive and may be used to diagnose or evaluate problems in an animal internal organ or check on the pregnancy. Ultrasound also can be used underwater. So this technique will use sound wave to detect objects underwater, which is essential for navigation, underwater exploring, and mapping on the ocean floor. Also can be used to locate the shipwreck, fish, and study marine.
Nowadays, there is many machine or application in real world use a ultrasound wave. Firstly, a medical imaging machine. It uses sound wave to create two-dimensional images of organ or other parts of the body, including viewing the uterus and ovary during pregnancy, diagnosis gallbladder disease, evaluating blood flow, and more. Next, sonar. Sonar uses sound wave to detect objects underwater, which is essential for navigation, underwater exploring, and mapping the ocean floor. Also used to locate shipwreck, fish, and study marine. Lastly, the non-destructive testing machine. It uses ultrasonic wave, which is a high frequency of sound wave to detect flaws in materials without damaging them. It's a method to detect internal defects inside, such as crack, porosity, and corrosion. There is many potential benefit and challenge of ultrasound wave, but it depends of the usage. Firstly, the ultrasound or ultrasonic sensor. The ultrasonic sensor have several advantages, including high frequency, sensitivity, and penetrating power. which make it easy to detect external or deep objects. However, they also have some disadvantage, such as being non-functional in a vacuum and not designed for underwater use. Next, the diagnostic ultrasound imaging. The ultrasound imaging have several advantages, including no ionic radiation, portability, simplicity, and the ability to image nerve. However, it also has some disadvantages, such as the quality of the image being significantly affected by the patient physics and ultrasound wave not penetrating bone well or passing through air or gas.
Let's dive into the future development and innovation of ultrasound. In my research, I've got a lot of points that I can point out, but I choose 4 points, which is enhanced image quality. Advancement in ultrasound transducer design and signal processing technique will lead to higher image resolution, improved contrast, and better tissue characterization. This will enable more accurate diagnosis and the ability to detect subtle abnormality. Second, we have 3D and 4D imaging. 3-dimensional 3D and real-time 4D imaging will become more commonplace in clinical practice. These technologies offer a more comprehensive view of anatomy and dynamic processes, aiding in complex surgeries and fetal imaging during pregnancy. Also, we have wireless and portable devices. Advancement in miniaturization and wireless connectivity will lead to the development of more compact and portable ultrasound devices. This will facilitate point-of-care imaging, remote consultation, and use in research limited setting or emergency situation. And lastly, which is fetal imaging and monitoring. Advanced fetal imaging technique will improve the early detection of congenital anomalies, providing valuable information for prenatal counseling and early intervention. Let's look at innovation of ultrasound. There are several innovations and emerging trends were shaping the field of medical technology. In this case, I will choose 2 points of innovation ultrasound, which is artificial intelligence (AI) and machine learning. AI and machine learning have been increasingly integrated into various medical applications, including medical imaging, diagnosis, personalized treatment planning, and drug discovery. AI algorithms are being used to analyze large datasets, aiding in faster and more accurate diagnosis, as well as predicting patient outcomes. And lastly, we have robotic in surgery and rehabilitation. Surgical robot and robotic assisted procedures are been advancing, enabling surgeons to perform complex surgeries with enhanced precision and reduced invasiveness. In rehabilitation, robotic exoskeletons and assistive devices are being developed to aid patients with mobility impairments.
In conclusion, ultrasound waves represent a versatile and invaluable tool in medical diagnostics, industrial testing, and scientific research. Their importance, benefits, applications, and instrumentation underscore their significance in modern healthcare and technological innovation. Continued research and development efforts are essential for further advancing ultrasound technology and expanding its capabilities to address evolving healthcare needs and scientific challenges.